Moving on, we are very honored that State Assembly members Kalra-Alex Santiago and Alex Lee have found time in their busy schedules to join us tonight. They are respectively the author and joint authors of CalCare AB 1400. They will explain what a single payer system like CalCare AB 1400 will do and how it benefits all California residents. So the floor is yours, Assembly members.
Thank you so much for having us. I look around the Zoom room and I see so many friends and incredible advocates, and I'm meeting some new ones like Taiji, who spoke so well about the need that exists. I saw my friend Stephen Gibson and spent some time with him when we were wandering around launching walks for Bernie Sanders. And of course, great to be here with CNA as well as a number of nurses who are taking up the battle on the ground as I work with CNA and my colleagues to try to push forward a policy in Sacramento. And look, the reality is this, and I think that a lot of you are familiar with what single payer is. And so CalCare itself, AB 1400, essentially would codify a single payer healthcare for California. The reality is we know, all of us know that we spend more on healthcare than anyone else in the nation, any other nation on earth. And we don't get the same outcomes. We have many thousands who die because they don't have healthcare. Hundreds of thousands across the country go bankrupt. And millions, even here in California, millions that don't have healthcare or don't have a real adequate access to healthcare. And so the three things that we need to do are put forward a policy that brings us justice in healthcare. And I believe healthcare is a human right. And right now we're denying a human right to far too many of our brothers and sisters. We need a policy, we need financing, and we need the political will. And so those are the three things. We have a policy right now. Please check it out, AB 1400. We're very much in the works on the funding and financing of it, but the reality is that it's going to take political will. It's going to take the people coming together. The API community plays a critical role in this. Where I live, the largest Vietnamese community of any city outside of Vietnam. And as Taiji mentioned, 1 of 5 Vietnamese Americans do not have healthcare at all. And so this model minority myth extends itself to healthcare access as well. Not to mention those working on the front lines, whether it's our Filipino nurses, whether it's our farm workers, and whether it's those that are being forced to work because they're deemed essential but treated like they're sacrificial. We need to show not only dignity for them and their work, but dignity for their health and their family's health. And I'm very honored to have Alex Lee and Miguel Santiago as joint authors, and we have a total of 18 of us that are signed on as me as the author and a number of joint authors, co-authors, principal co-authors. So we are building the movement in the building as you all are building it outside the building. So I'm happy to turn it over to my colleague, Alex Lee, to talk a little bit about his support of single-payer healthcare as well.
Well, I couldn't put it any better than our fearless leader in the fight for single-payer universal healthcare, Assemblymember Kalra, who represents San Jose, just to my south. I represent Assembly District 25, which is the communities Alameda and Santa Clara County, just north of Osh. And Osh, to put it right, we pay as consumers the most for healthcare in the entire developed world, and yet we get for fundamentally worse results. But everyone on this call already knows that fact of life. So if it's really possible, what we really need your help in the coming months is to really build that groundswell of support where it's an undeniable force that we must pass healthcare. And look, it's not going to be easy. It's not going to be overnight, because unraveling this system is a generous word, right? But unraveling this labyrinth of healthcare that exists in America is not going to be done overnight. And there are a lot of entrenched special interests that benefit from the status quo, powerful special interests that will do everything they can to squash this movement. So that's why it's so important for you to activate and talk to your friends, your neighbors, your community, your representatives, everyone across the board to really pass this single-payer healthcare. AB 1400 is the most recent but also most real shot at getting it, while we have Democratic control of the White House, of the Senate, of the U.S. Congress, where everyone has said they want universal healthcare. This is the time to do it. This is the window, and we cannot miss it. So while there are people that will slow walk us and constantly obfuscate, we can't have that anymore. So we need your support to be really building that groundswell, and we really will enjoy that. But I don't want to yammer on, but I want to turn over to Miguel Santiago, who is our also joint author on it. and who is also from Los Angeles. Miguel, you're on mute right now.
There you go. Thanks, Mr. Ashkara and Mr. Lee, for talking ahead of me, and for the group that that's been advocating for us. Let me just cut down to the chase and be real. And I know it's already been said, but we have some real challenges in getting this through. And the best way to beat this is to do what we always do best, which is create that groundswell of people power movement that makes it a mandate to get through. But also understand that we've got the best arguments, and we've got to articulate them in a way that people can understand. Now, I'm going to talk a little bit about why it's important to me, the district that I represent, and the general area. And I represent, as most of you know, the 53rd Assembly District, which ranges all the way from Koreatown, downtown Los Angeles, Pico Union, MacArthur Park, Boyle Heights, the Huntington Park area, Vernon, and surrounding communities. What we learned during the pandemic was that our areas were the hardest hit, not just economically, but also healthcare wise. And we knew that we needed to do something, and we needed to act boldly at a time when people needed single payer or a change, and this change in healthcare more than any other time in their life. But what I will also say, oops, somebody gave me a call, so I don't know if that bumped me off Zoom for a second there. But what I will also say, though, is my district and the region is uniquely centered because we have a large population of Latino undocumented immigrants. Likewise, low-income Korean and low-income Japanese Americans. In the Korean community that I represent, there is folks who are undocumented, and we have Bangladesh, and we have other areas. If you read the LA Times report today, one of the articles, it talked about indigenous communities indigenous communities that are now traveling, to our district, mostly Pico Union, MacArthur Park, where there is a challenge even for folks who understand and speak Spanish like myself to communicate with indigenous communities from Mexico or other areas. Our areas have been the hardest hit. And when we talk about single payer, when we talk about medicare-for-all, when we talk about universal health care, what we're really talking about is giving the opportunity for these people, the people that I represent, my community, my culture, to be able to have access to health care, because it isn't available today. And I know that we all agree on how expensive it is, and we all agree on the corporatization of healthcare. But what's really at stake is people having the ability to have basic quality healthcare. And when we take a look at just dental coverage that people don't have, and they haven't had in their life, and they're here and they're desperate for it, when we take a look at mental health care services, when we take a look at care for the senior, when we take a look at just basic checkups, basic healthcare coverage, I'd like to argue that in many cases, our district is ground zero for why there is a need to have this kind of change in the healthcare system. And I'd also argue that it's not a radical idea to make sure that people are healthy, right? I mean, it's not. And when we talk about the very nexus of what income inequality manifests itself in a community, it is those areas where you don't have even basic healthcare coverage. And this comes from an area that I represented that had the highest contraction rates for COVID, highest unemployment rates. It also had the area where we fought extremely hard just to get basic COVID testing. And then when the vaccines were available, we doubled down those efforts because there was no vaccines in sight in the areas that we represented. So I've got a very clear argument on behalf of our district and the surrounding communities to advocate why we need massive transformation in the healthcare system that looks like AB 1400, that finally we take a look at a healthcare system that is going to work for people and not for corporate profit. Look, I'm extremely grateful that you have invited me to talk a little bit today about this, and to our colleagues and the people-powered movement that is being built today. Now, if it hasn't already been mentioned, there is a rally. I believe it's July 24th. I hope I get this date right. Mr. Osher, Mr. Lee will correct me. But we want to plug that rally in to everything that we do, everything that we say, so that people turn out and march and make our case public as to why we need this transformative change and why AB 1400 is so greatly needed. So thank you very much for having me on.
Yeah, and to Miguel's point, that's a national day of action for Medicare for All. But in California, since we have a bill, we can focus on AB 1400. We can focus on CalCare. as we push the nation forward. You know, California leads is what we do. We lead, and we should be leading with compassion. You know, in recent decades, we have seen this, you know, income inequality divide grow, people struggling without health care, without housing. And the reality is that we've been allowing those that have the wealth to be out in the front leading with greed in mind. We have to flip the script. We've got to do a 180, and we've got to lead with love and justice and compassion. And if we do that, we can make CalCare a reality in California.
You all ended a little early. Does anyone want to add anything?
I will say this, to Miguel's point, this is not going to be easy. You know, we know that our current healthcare system is the most expensive, well above 400 billion, as much as 450 billion a year. CalCare is 400 billion a year by estimate. And the current system doesn't cover everyone. So where are those tens of billions of dollars going? They're going to profit, which means there's going to be a lot of money available to push us back. So we've got to rise up, and we've got to, you know, first of all, good policy. And we've been working really hard on the policy. And I believe Carmen Costi with the nurses, one of the best minds you'll have on healthcare policy, has been doing a phenomenal job leading the effort for the nurses. We've been working hard on funding, and I'll tell all of you this, in the last over 2 decades, there's been about half a dozen different single-payer policies that have been put forward. I'm the first one that's actually put on paper a funding plan. And so we're serious about this and about finding the funding. Again, even though it's cheaper, it's not as simple as saying we're going to move money from bucket A to bucket B. Bucket B is CalCare. Bucket A doesn't exist. It's actually a bunch of buckets. We got to figure a way to coalesce those funds into one bucket of CalCare. And so we have to recognize that it's going to be a difficult journey ahead, but we know that we're on the right side of history. It's the right moral issue. It's the right fiscal. It's good for our businesses, good for our employers. And so we need to go with urgency. And there's a lot of folks that will tell us to wait. And look, we've waited for decades. People are dying. Now, I agree that we should be thoughtful and deliberate, and we are, and not be rash. And we're not being rash. We're being very thoughtful, and we're going to put forward a policy, a budget, a fiscal plan that works. And then it's a matter of us pushing it forward, because if we don't, we know that we're going to suffer with this continual downward spiral of a for-profit healthcare system that really has had literally no problem with many thousands dying every single year for decades, because that's the system we've had. And if that's okay with all of you, which I know it's not, then we'll go with the status quo. But for us, we know it's unacceptable, and it's great to see doctors on board. I see Dr. Wynn. I've heard from a lot of doctors, including a lot of API doctors. I have a bunch of my Indian friends that are doctors, and they want a change. For the first time, we see a majority of doctors are now in favor of single payer. And many of them, as we know, are API. Those are our sisters and brothers who are going to join us in this fight with the nurses and other frontline healthcare workers to push against these illogical arguments. Fight on logic, fight on fiscal responsibility, and fight on morality. We put those three together, we win.
Thank you very much, Assembly members, for pointing out that we cannot wait for guaranteed health care for all in California, and that we collectively need to make the political will to make AB 1400 a reality. So we thank you as well for authoring the bill and leading the charge in the State Assembly. So we know, Assembly Member Kalra, you have to leave for another engagement, but we invite Assembly Member Santiago and Lee to stay as long as they like, in case you'd like to hear what the other speakers have to say and to participate in the discussion afterwards.